Good morning to everyone. Today topic is the applications of computers in pharmacy. Nowadays, the computer has been become a very common tool in the area of science and technology. And also, the use of the computer in pharmacy become a importance day by day as you can provide a critical information on a drug, any drug or interactions and usage and storage of the drug and mode of the action, side effects, etc. and remaining total information of the patient details and every time using the pharmacy also and computer is also using the computers very much. And in the it is also used for the patient counseling, and computers are used to keep a track of patient records. If you have in the number of patients in a hospital, the total number of patients having the every patient having the own record is there, that records are stored in the one database or computer. That purpose you are using the computers very useful to in your daily life, and also use it for the provide them the appropriate medication of the per symptoms and all allergies and particular medicine list. And every time the computer is very needful to your hospitals or anywhere you are using. That is the use of the computers in the pharmacy in the computers. And in the major users are there, some major uses of a computer pharmacy. Major users also using in the computers. First one is the manage patient record. Manage patient record, that is the major one. And second one is the enter drug orders. Enter drug orders. And third one is the monitor drug interaction. Monitor drug interactions are allergies, if any. That is the third major use of the computer. And fourth one is the automated dispensing. Automated dispensing. Fifth one is the inventory control. Sixth one is the medical research and analysis. These are the 6 major uses of the drug of a computer. In first one is the patient records. If the patient records means, then every patient having the individual data is there. Every patient, some patients are some diseases are there, and some patients are every patient having the different problems are there and different solutions to the diseases to decreases that diseases. In this patient manage the patient record means that patient inpatient or outpatient, which time he is joined that hospital and which diseases to suffering for the particular person, and how many members are there in the outpatients are there, and particular person having the any diseases other or BP or sugar or any diseases are there. The total informations are record even maintaining the one record. That is called the managing the patient record. That is called the patient record. It means patient having the which condition he is joined that hospital, the total information there in the patient record. And also sometimes patients having the discharge or any severe diseases are there, and severe diseases to suffering, that time also that patient information total enter into the record. That is the managing the patient record. And next one is the enter drug orders. In the hospital having the medical shop or medicine is there. In that medicine having the different types of drugs are used. In the suffering for the suffering from the some headache or some fever or some any other diseases, every disease having the some particular drug is there, the total drug information, how many types of drugs are there in that patient having the which diseases to suffering, that different, how to decrease that diseases, which diseases having the which drug you added, the total information is there in the drug order. That is the second major use of the computer pharmacy. That drug order also maintaining one record, and that record is also stored in that computer. That purpose you are using the computers in pharmacy. Next one is the monitoring drug interactions or allergies. Any drug information or monitoring means it maintaining one record or one book in the computer. And automated dispensing and inventory control and medical research and analysis, the total information, any medical research or x-rays or scanning reports or ECG, and any tests or doing that particular person or particular patient, the total information there in the computer. And also which test having the how many money is we spend that which test having the particular rupees. It means x-ray having the some 100 rupees or CCG having some 1000 rupees. The total information also there in the computer, and the particular record is maintaining easily understood to the patient and hospital in charge or anyone is easily understood. Sometimes the patient having the any record is missing, that time he is coming to asking the receptionist in day and 1 year or 2 years ago I will patient in that hospital, that particular record also search and giving to the particular person. That purpose you are using to the maintaining the particular record, every time you are using to the very useful. And next one is the computers in pharmacy. Computers in pharmacy. Computers in pharmacy having the patient profile. First one is the patient profile, and next one is the billing. Third one is the prescriber profile. Fourth one is the labeling. These are the four types of the computers in pharmacy. First one is the patient profile. Patient profile means allows the complete information about the patient name, patient father name, patient address and patient phone number, and total information there in the patient profile. It including the insurance in patient having the some patients having the any insurance policies or health policies are there, the total information there in the patient profile. And also medication history and allergies and identify drug interactions for patient taking multiple medication. It means in previous the patient is any diseases are there, and which disease having the which which drug are used, that information is also there in the patient profile. Patient profile means patient name or name, address and particular diseases, total information there in the patient profile. That is called the patient profile record. Next one is the billing. Billing means in the some patients having the giving the billings is the some patients are checks using the checks, or some patients are liquid cash, some patients are using to debit card or credit card. The two is the billing. Checks policy for the third parties such as the HMOs and insurance authorized third party transactions and credit cards are electronically. It means billing means some persons are using to the electrical, some persons are using to the ATM cards or debit card or credit cards, or some third persons are there, some insurance persons are there, and some health cards is there. Any patients having the health cards or insurance, and some third party. It means some third party means in the some having the some small villages having the any patients having the not come to any transportation is not there, that time some doctor or another persons are coming to take and join that hospital. Some percent having the any percentage to give take in that person. if some RMP doctors or any other patients are joining that patient to the hospital, in that time third party person is asking some money or percentage to the that patient having the I will admitted, that time I will give to the some percentage of money, 1%, 2%, 5% or 10% money to give it to the third person. That is called the billing. And next one is the prescriber profile, includes the state identification numbers and affiliating the facilities and insurance. Any identify numbers and affiliated with the facilities or any facilities or insurance. The total information is there in the insurance. This is there in the prescriber profile. And next in the label, create a label receipt to customer information and uses in the instructions. Some instructions are used to create say labels or receipts. Any receipts are giving to the discharge time or any medical time, or that information is stored in that labeling time. Information is there in the some particular computers. This is the labeling. These are all the four types are there in the computers in pharmacy. This is the major use of the computer pharmacy and the computers in pharmacy. This is the topic. Everyone understood? Thank you.